So what you see here, and this is called a rhythm strip, is what's called normal sinus rhythm because it is originating from the sinoatrial node. And so normal heart rate is between 60 and 100 beats per minute. Again, normal sinus rhythm, you can see the space between the QRS complexes, each one is even, so there is no irregular beat. And then if you look at these slides, the very top one, sinus bradycardia. So bradycardia just means the heart rate is below 60 beats per minute. It can mean a person has a disease, but oftentimes you will see in people who are very aerobically fit that they have very low resting heart rates, 50s, 40s. Lance Armstrong had, I believe, 28 beats per minute. That's kind of cool that his heart rate beats once every 2 seconds. Sinus arrest is in B. You can see where you've lost that SA depolarization from that sinoatrial node, and so you've got dropped QRS complexes. So again, that's not that common. That's probably not something we would see. And then sinus tachycardia, and that just means, heart rate is greater than 100 beats per minute. Now, tachycardia can occur at rest. Say if someone's had caffeine, if people use particularly ADHD medication, you will see tachycardia at rest, or tachycardia is just going to occur during exercise, and that would be very normal to have tachycardia during exercise. Premature atrial contractions. Sometimes what happens with in the heart is that every cell in the heart is capable of being the pacemaker of the heart. So sometimes you get you might get a heart muscle cell in the atrium that kind of goes rogue, and so it starts to be rebellious. And so it's going to start trying to also issue its own beats and trying to get the heart to contract. So that can happen, particularly people who have underlying heart disease, but so premature atrial contractions. It's a little hard to see on this rhythm strip down here. That's where you have sort of these weird looking P waves. Like you've got your nice normal PQRST here, your normal PQRST here, but then you've got like this, weird looking P wave and a little bit weird looking QRS. So again, it's a little hard to see, but so they're not normal shape, and the QRS is just, is looking very abnormal as well. But that could be one, you might see it on the test. You could see it on the certification exam as well. Premature ventricular contractions, or PVCs. That is when your QRS complex looks very wide and big, and these are very, very common, particularly people who have caffeine. Lack of sleep, stress, caffeine, certain drugs that may be caffeine-like. People will also have them if they've had a heart attack or if they have ischemia, where they have narrowing of their coronary arteries. But yes, it is entirely possible we might see some PVCs in our ECG lab, especially those of you that drink caffeine. So again, isolated PVCs are, totally normal. Everybody has them. I mean, you feel that. Sometimes you feel your heart skips a beat now and then. That's what's happening. You're having a PVC. So 2 PVCs in a row are called a couplet. Again, if people start to have a lot of PVCs, or they start to have a lot of 2 PVCs in a row, they might want to get those looked at. But everybody has an occasional irregular beat now and then.